An accident results in some type of bodily harm or a pain that may have been caused by an unknown injury. Now there are 3 important questions that you need to ask your patient before making a diagnosis. Firstly, you need to ask the patient about the date of his last tetanus shot, the last time he ate before his injury occurred, details of the injury. Secondly, you should know if he or anyone in his family has had any chronic diseases or allergies. Now, one more important question you need to ask is about his medication history. If your patient is taking any medications, well, this is because this particular condition might be the result of adverse drug reaction to any of these drugs. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes a blood pressure, pulse, a breathing rate, a breathing pattern, and examination of the injury and associated areas. After examining the injury, you will take certain steps to ensure that your patient can breathe, his neck is protected, that he is not bleeding out of control, and that he is in no risk of going into shock. If he has experienced severe head trauma, gunshot wounds, stab wounds, or blunt injuries to the chest or abdomen, you will continue to monitor him closely for months or even longer to ensure him suffer no lingering effects of injury. Now, we will be discussing 6 types of injuries today: head injury, a chest injury, abdominal injury, pelvic pain or injury, injury to arms or legs, or neck or back injury and back pain. First comes the head injury. In the case of head injury, you will ask your patient about unconsciousness, or whether he remembers what happened right before the injury occurred, the vomiting after the injury, the weakness, loss of sensation or coordination, or whether he knows who and where he is. Now you have to examine the patient. Well, this physical examination includes a thorough head and neck exam, looking inside the ears, checking for clear discharge from the nose, testing reflexes, sensation, and strength. Now, what are some factors that you need to consider after head injury? Well, there are 2 different factors that you should be clear about: neck fracture and skull fracture. Now, if the patient shows symptoms like neck pain, neck tenderness, or occasional malalignment of the neck or paralysis in the arms or legs, then that might be due to the break in a vertebra of the neck. That means a neck fracture. While, if patient has unconsciousness lasting more than 5 minutes, loss of memory for events that directly preceded the injury, then that might be due to the break in one of the bones of the skull. That means a skull fracture. Next comes the chest injury. In the case of chest injury, you will ask your patient about a breathing trouble, vomiting, or coughing up blood after the injury. Now you have to examine the patient. Well, this physical examination includes a blood pressure or thorough neck exam, or checking for tenderness in the ribs, and listening to the chest and heart with a stethoscope. Now, the factors that you need to consider after chest injury are pneumothorax, hemothorax, cardiac tamponade, or flail chest, injury of lung tissue, airway obstruction. I'll be explaining these terms in a while. Now, if the patient shows symptoms like trouble breathing and chest pain, then this might give you an indication that patient has hemothorax, that is a collection of blood between the lungs and chest wall, or it might be a pneumothorax, which is an abnormal collection of air between the lungs and chest wall. Or it can also be due to the flail chest, which is in fact severely labored and abnormal movements of the chest caused by penetrating injury. Now, if your patient is just experiencing trouble breathing, then the responsible factor for this might be an abnormal collection of fluid or blood around the heart, compressing the organ, means cardiac tamponade. Or airway obstruction might also be the reason for this. That is in fact the blockage of airways. Now, if the patient experiences trouble breathing and he is coughing up blood, then injury to the lung tissue might also be the reason for this. It is the damage to the tissue of lungs. Next comes the abdominal injury. In the case of abdominal injury, you will ask your patient about abdominal pain or blood and urine. Well, the physical examination of abdominal injury will include a blood pressure, pulse, pushing on the abdomen, or checking for stability in the bones of the pelvis, digital rectal exam, and checking stool for the presence of blood. Now, the factor that you need to consider after the abdominal injury is damage to internal organs or bleeding as a result of injury. Well, its typical symptoms include abdominal pain, tenderness, or bruising. Blood and urine more common after a penetrating wound. Now we have the pelvic pain or pelvic injury. In the case of pelvic pain or injury, you will ask your patient about the blood and urine, inability to urinate, numbness, or decreased strength in legs and feet. Well, the physical examination of pelvic injury will include a blood pressure, pulse, thorough abdominal and pelvic exam, measuring leg length, and testing reflexes and sensation. Now, what are the factors that you need to consider after the pelvic pain or injury? Well, they can be pelvic fracture or urethral tear. Now, pelvic fracture or a break in one of the bones of the pelvis has the typical symptoms like pain on weight-bearing or direct pressure to pelvis, or change in strength and sensation in legs, or blood and urine. While urethral tear is a tear in the tissues of the urethra, which drains urine from the bladder. Its typical symptoms include blood and urine, and inability to urinate. Now, what if your patient has the injury to the arms or legs? In the case of injury to arms or legs, you will ask your patient to remove any jewelry or clothing that could become constrictive if the injured limb begins to swell. Well, the physical examination of this kind of injury will include a pulse, or temperature, sensation and movement in the injured limb, testing joints for mobility and stability, checking joints for swelling, and testing for broken bones. Now, the factors that you need to consider after injury to the arms or legs include a nerve or vessel injury, fracture or dislocation, open fracture. Now, by nerve or vessel injury, I mean a damage to the nerves or blood vessels in the injured limb. Well, its typical symptoms include loss of sensational movement in the injured limb, pallor, coldness. While, in the case of fracture or a dislocation, where there is a break in one of the bones of the injured limb, the typical symptoms will be loss of function in the injured limb, tenderness, swelling. An open fracture is the one where a bone protrudes through the skin. Now lastly, we have neck or back injury and back pain. In such case, you will ask your patient if he has weakness, loss of sensation in arms or legs, pain in the neck or back, trouble moving the back or spine, blood in urine, and inability to urinate. Well, the physical examination of this kind of injury will include a checking neck and back for tenderness and alignment, looking for tenderness in the spine and along the sides of the body, or pushing on the abdomen, and testing reflexes and sensation. Now, what are the causes of neck or back injury or back pain? Well, these causes can be muscle strain, arthritis, herniated disc, spine fracture, spinal stenosis, major neurological deficit, spinal cord injury or compression, herpes zoster, malignant tumor in vertebrae, of urinary tract trauma, and abdominal aortic aneurysm. Now, Muscle strain is reversible injury to the muscles that can occur after lifting heavy objects. This is the cause of about 70% of back pain. Its typical symptoms will be sudden onset after strenuous activity, and pain does not move to legs. Next, we have arthritis, which is the inflammation of the joints, and the pain is usually present in extremities as well as back. Now is the case of herniated disc. That is in fact an abnormal bulging of the spongy discs that keep the spinal bones properly spaced. Here, patient will have difficulty moving legs worsened by coughing or sneezing, or may involve difficulty urinating, and sometimes follows spine fracture. Now, is the case of spine fracture. I mean the break in one of the vertebrae, often due to osteoporosis, which primarily affects women after menopause. The patient will feel neck or back pain. Next, we have spinal stenosis, which is the narrowing of the space in the bones in which the spinal cord sits. Its typical symptoms are low back pain moving to the thighs. Pain may be relieved by bending forward, or thigh weakness, and unsteady gait. Now is the case of major neurological deficit, which is in fact an injury to one of the nerves that comes out of the spine and travels to the extremities. Here, patient will have loss of sensation in the extremities and difficulty urinating. Next comes spinal cord injury or compression, which is the damage to or constriction of the spinal cord. If this is the cause, then patient might present with paralysis or numbness and has inability to urinate. Now is the case of herpes zoster, which is a reactivation of chicken pox, also known as shingles. Here, pain is usually on skin in a narrow band around the body. Next cause can be malignant tumor in vertebrae. That is a cancerous growth that has traveled from another part of the body into the bones of the spine. Here, the patient usually has a history of cancer, pain when certain bones of the spine are touched, and usually severe and worsening pain. Next, we have urinary tract trauma. That is the damage to any of the organs that help funnel urine out of the body. Here, symptoms are a pain in the back or sides, and blood in urine. Now the last cause that we are going to discuss is abdominal aortic aneurysm, which is abnormal bulging of the largest blood vessel in the body and is life-threatening. Symptoms associated with it are extreme pain, and pulsing mass in the abdomen may be associated with weakness. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of injury. Stay tuned to sqadia.com for more such precise and knowledge stuff videos.